you're taking someone who's broken, who is not happy with themselves, who has a poor diet, who doesn't, who has bad relationships or they develop them over time. And now what we're trying to do is reconnect and rebuild that whole area right there. And while it may do a lot, in the long run, you're still sitting with this patient, you're still talking with them, you're still listening to the things that they're going through. And so that part of the art, part of the work is the conversation and the communication with the patient to find out where they are and where they want to be.
Hi everyone, welcome to this episode on the Happy Practice Playbook. I'm Mo Jones, and in each episode of the show, you'll hear conversations with dentists, office managers, staff, and specialists who know how to create a happy practice. Today, we're joined by Dr. Bilal Beckles and Darryl Jackson, business partners who are also fraternity brothers when they studied at their undergrad at Virginia State, Alpha Phi Alpha. Dr. Beckles is also a dentist specializing in prosthodontics, and Darryl is the Chief Operating and Growth Officer at Comprehensive Dental Science. Gentlemen, welcome to the show today.
Thank you. Welcome.
Thank you.
Thank you for welcoming us. We're excited to be here.
Yes, and thank you for the opportunity.
It's going to be a great day. And for our listeners, we are actually doing 2 episodes with Dr. Beckles and Darryl. So we'll have 2 different topics, so even more fun. So buckle up to our listeners. We've got some great topics to go over.
Yes, indeed.
So we love to start each episode with a statistic. And for this episode today, our statistic is, in a recent study by the International Journal of Emergency Mental Health and Human Resilience, 80% of dentists who had artistic activity reported being stress-free, while out of dentists who did not participate in artistic activity, only 17.5% had no stress. So, Dr. Beckles, we'll start right off with you. How has being an artist helped you with your stress levels at work?
Well, I believe actually, and that's a great question. We always need an outlet. Our job consists of, and we're tasked with solving people's problems. And a lot of times it's under pain. It's involving their parents. It's things that are impacting them heavily. And we're seeing multiple people, one after the other in each appointment. So what we end up finding, you're diagnosing, your treatment planning, you're solving these problems, but this weighs on you, it stacks on you. And as those problems compound, if you don't have an outlet, for me, it was always art. I mean, since I was little, I would draw, it was graffiti, it was different things of that nature. And then I more recently got into painting. So trying to find that release and making sense of your own personal world after solving everyone else's problem, that's the key to having that peace and finding that comfort and not taking the stresses of your job and the world on.
I think Dr. Beckles is being really modest. He's a great artist. And I mean, just the nature of our practice and the nature of being a prosthodontist, you're doing reconstructive, restorative. You have to see it before you can build it. And him being an artist really helps our practice and helps the patients that we solve, because they come in with a variety of issues, whether it's something with their appearance or something that's actual clinical, where it affects their chewing or breathing. He has to see it and he has to draw it in their mouth pretty much. He has to build it in order for it to be successful. So I think it's being really modest and just relying on the artistry after work. The artistry is work for him. and I make sure he stays on it too, because, iron sharpens iron, and I want to make sure that his art stays good so the teeth stay good.
Yes. But, and honestly, it, again, trying to kind of walk that line, but really what you're looking at is in dentistry, a big part of it is mental health and therapy, because you're taking someone who's broken, who is not happy with themselves, who has a poor diet, who doesn't, who has bad relationships or they develop them over time. And now what we're trying to do is reconnect and rebuild that whole area right there. And while it may do a lot, in the long run, you're still sitting with this patient, you're still talking with them, you're still listening to the things that they're going through. And so that part of the art, part of the work is the conversation and the communication with the patient to find out where they are and where they want to be.
So Darryl had also mentioned, right, when you for you as an artist, Dr. Beckles, when you're painting things outside of work, but essentially when it comes to your job, you're painting a picture inside your patient's mouth and with their health. And would you say that let me think how to better word this. Would you say that because you have that outlet of being an artist thing that has helped you become a better dentist and better help your patients because you're painting that picture for them?
Yes, yes. So I always say, and then this is just something I came up with, but I always think that there are three major components of art that you have to have. One is sensitivity. The next one is accuracy, and the following is functionality. And so, with the sensitivity, not only in these micro sculptures, because what we're trying to do is recreate what God made, or however whoever you believe. We're trying to recreate physical models and that will go right into function in a moist environment, high pressure, and different things of that nature. So having sensitivity about how your work is going to come out, how the patient is going to accept it, but also having sensitivity toward the patient, that they are people, they come with their problems and everything else, and building that bond together. The accuracy comes with these have to the teeth meet thousands of times a day, a minute, per second, as we swallow, we speak, we eat. And so when we get into reconstructing those areas, the muscles are going to follow where the nerves are directing them. And anything that is out of place can cause multiple areas of dysfunction and issues with the patient. And so your accuracy has to be as close as possible in recreating that. And the last one is functionality, which speech, eating, mastication, and chewing, smiling, communication, and everything has to be able to resume as soon as you're done with your work, so that you don't stunt people's life and their progression.
So with that, obviously, right, Dr. Beckles, you've adopted this. You have a passion. How do you extend that to your staff? Do you encourage them to also have an artistic outlet, and does that help better serve your patients as well? And Darryl, I mean, you can weigh on that
Yeah,
too,
I think
since
I'll
you're
jump in
you're
on.
part of that.
Yeah,
Yeah,
absolutely.
go ahead, Darren.
I think we talk to our team all the time about active listening first and foremost, because we want them to understand what the patient's issues are. I think the other thing is we want them to be present. A lot of times we deal with professionals that aren't in the room when you're speaking with them, because they're a million other places, and I understand physicians and doctors and dentists are the same. You may be thinking about another patient, you may be thinking about what you have to do with this patient, but we want our staff to be present first and foremost. I think the second thing is we want them to really be really be empathetic to the patient, because we don't, they could be going through anything, and as Dr. Beckles stated, just it's more than the aesthetic value of their mouth. There's a ton of things that can be going on, so we want them to be empathetic. We want them to be active listeners. And I think finally, from the art, from the being artists, I think the one thing about being an artist is you have to understand you have to understand your surroundings. You have to be really cognizant of what's going on around you. And we talk to them about that all the time. So I think, and then the last thing is, in a new society, in this technological age, is no longer just, pushing papers or administratively doing things. We want them to be connected to everything that we're doing. And that includes the outlet after work. And I think that's really important as well for mental well-being.
Yes, yes. And all I have to add to what Darryl said is the practice is my studio. So all the art on the wall is mine. We took all of the art that that was on the wall. If it didn't have my name on it, I was putting my art up. Because why not?
That's
And then
dope. That's dope.
also it puts you out there, because again, what was that? Erica Badu said, I'm an artist and I'm sensitive, right? So that kind of when you do that, it's the same way when put veneers, a denture, implants, or someone in something in someone's mouth, and they have to go out to people that are familiar with them. So anything that's off, especially with children are so honest. Anything that's off, they will point it out, and then that patient will be back at your front door, with steam blowing out of their ears. But that just knowing that you're you're making that presentation, you're cognizant of that this is going to be out there for everyone to see it. It's kind of a reflection overall in the practice. So patients can walk past and go, "Oh, why is that? Who did that?" On the wall. But you got to sit there. Oh, yeah, that was Dr. Beckles. But still, it's something. I think it brings that idea of where I come from and my visions and how I go about things to the practice and the staff
Yeah, I've seen the
and the
art.
patients also.
I've seen the art on the wall do a couple of things. Number one, I think that it's Dr. Beckles' resume on those walls. Like, they show how great of an artist he is. And then the other thing I think it does is it really breaks the ice with the patients. They ask, who did that painting over there on the wall? He's like, I did. And then it just you can see the level of ease in their face as he says that, because they understand that he's more than just the prosthodontist. He's more than just the sleep apnea specialist. He's also a person that does art, and I think that makes him more tangible to the patient.
So with that, this is just me, but I feel as though because you've done this and you are you're presented more as a well-rounded person. You're not just a dentist, but then you're not just an artist. You're everything, and I feel like that bleeds out into outside of the walls of your practice. Have you seen that impact the community around your practice in presenting yourself that way?
Yeah, well, one thing, the community around my practice is where I grew up. When I was born and raised in Harlem, and so to be able to be back home, to be able to offer not only prosthodontic care but obstructive sleep apnea treatment, and looking at the patient's overall health, and looking at how we can bring people out of a state of resting sickness, because a lot of people that's what we were essentially in when COVID-19 and these things disabled us. Everybody was at the height of decadence, of indulgence, and it was almost a perfect storm. So it took a little, and I'm not decreasing it, but it took a small virus to wake everybody up to their own health. And so to be home, and I received the letters just like everyone else, and the emails to work in the hospital, almost feeling like a draft letter, and being home, I had, yes, I'm going to sign up. I mean, I was never called to it, but I said, yeah, I'm going to sign up because my family is here. And that was the one thing that really hit me hard. It was like, well, if you can do something, do something. And so that's what really pushed the practice in a direct direction where it's going, and our focus on the community and helping it change.
Absolutely. And then, when we took over this practice has been in the community since 1979. So it's been a pillar of the community. And when we took it over from Dr. White, there was a few things that, we had in mind. Of course, we wanted to develop our own strategic pillars, and those being actual practicing, thought leadership, as well as philanthropy. And those things are really important to us. Basically from college, that's what we grew up in our fraternity. First of all, service of all, we shall transcend all. And those things bleed over into our practice, into our everyday lives. So we want the community to see us not only as a pillar, as someone that's been there since 1979, but someone that's going to take them into the future, whether that be through exposure to medicine, whether that be to access to things that they haven't had access to previously or historically, or just their individual development from a health perspective, or from a knowledge perspective. So we're here, and we want them to know that we're here for the long term, and we're looking to grow. We're not just as the businessman on the phone, we're not just looking to be siloed and to be stuck in this space. We want to grow, and we want our business to grow, and we want our stakeholders to grow as well.
And also to add to that, as far as the impact on the community, I was one of the kids that had ambition but didn't really have a direction, and it took a dentist, Dr. Robert North, to literally grab me. Hey, you're working with me. had no idea I wanted to go into dentistry. I had no focus towards it. And this was 3 blocks from here at Harlem Hospital that I really found my passion. And then to be here literally about 30 years later, to be right in the vicinity of where I found, my love, my passion, and really the reason that I'm, my why, I guess a lot of people say, um, that allowed that even pushes me even further to make an impact here, because if I can get another one of me or another 5 or 10, then the things that we could do, with healthcare and with our community and with, just helping our overall families, we would be changing their trajectory.
Definitely. Dr. Beckles told me a powerful story about that. He said one day when he was working with the doc, he said he was working in his lab and he let him put on a white coat. And he wore the white coat outside to go to the store. And all his friends saw him in the white coat and it made him feel like Superman. Those are the things that that resonate. Those are the things that you remember. And those are the things that we want our young people to feel when they walk out. But I think that's a great story. I had to share that because that's what I think influenced him to be the doctor he is today, and then certainly influences the way we treat our community.
Yeah, and that was the summer of '92.
You just told everybody our age, man.
Oh man,
Listen, ain't nothing
I
wrong
hope
with
we're
that.
aging well. I hope we're aging well.
You guys look great.
Thank you.
Thank you for sharing that, Darryl. It made me tear up a little bit, just because I think, with your philosophy of being able to influence in the community, whether it's just bringing in these young kids and giving them an opportunity to see what their potential could be like, but also you guys have a comprehensive approach to dental care. And you mentioned with COVID too, that really gave people a wake up call of taking their health more seriously and looking more into those comprehensive things. And so outside of that, how has a comprehensive approach also helped you as a dentist become better, as well as uplifting the community in that way?
Well, I think, and if I may go back to the COVID-19 period, um, it was a humbling experience because to get called on to help in the hospitals and to get a phone call and they list, can you intubate? Can you do this? Can you do this? Can you do this? And I'm sitting like, yes, no, no, yes, yes, no. It was humbling because I mastered my wheelhouse. I can cut crowns. I can do cosmetics. I can do dentures. And a lot of doctors, we sit on our own islands and we become the king of them. And we're great at this and we're great at that. But when you get called to the stage and it really involves like, oh, wow, I'm not, the mouth is not separate from the body. We have to now look at, and not that we ignore it. We do our health exams, our health histories, but at the same time, it's almost as in, okay, these are the steps that we're going to go through. We want to make sure that you're healthy enough to get the treatment, but what are we doing to really impact your overall health? So what I learned was that I can't do this alone. What I do for the patient is good, but if I have a cardiologist, if I have a nutritionist, if I have a personal trainer, if I have a net or a web of doctors to focus on you, Mo, right? Because you're that valuable and you're that complex. I can't say that, hey, I'm going to fix a crown and then that's going to take away hypertension. But if I'm focused and I'm communicating with that doc, it's like, hey, let's get her off these meds, or let's bring this down. Let's get her eating this and exercising at this point in time. That way, we have a team looking after you. And there's one thing that I use. We often use cars as to associate with people because people can understand the value, but if you really want to look at humans, you want to look at them as hyper vehicles. If you would a Bugatti or a Pagani or something like that, that you don't drive those to Meineke and they fix everything. If you literally had a hypercar that's in the millions, it's about 10, 15, 20 people that work on that car. A tire specialist, a transmission, an engine. And that's how we need to approach people. And as we're able to do things like that and communicate like that, we can really start to see health rising. We can really start to see the cost of healthcare lowering, the cost of prescriptions lowering, because who needs to keep taking all of these if they're feeling a lot better, if they're mobile, if they're exercising, if they're eating right, and so on and so forth.
I know you hear the passion in his voice, so that's what he came to me with. When he's like, Darryl, I want to do this, this, and this. How do I do it? How do I do it? I'm like, brother, let's just sit down, and let's go through this step by step. And I think, as being on the business side, is kind of taking that passion and walking him through it step by step, because I don't want him to lose it. And he's the subject matter expert. I'm following his lead, but I also know that when building this business, we want to build it correctly. We want to build it so it's lasting. We want to build it so we have the correct reputation in the community and outside of it. And I think what I took from it, and what he took from it as well, is that it's a marathon, not a sprint. It's not a 100-yard dash. This is something that's going to take a long time. And I had to really explain to Dr. Beckles the concept of year zero. Because this is the first year of the practice, and in year zero, we don't make money. We don't do a bunch. But what we do is we set our professional reputation, we set our brand, we set our stakeholders, and we set our staff and our team. And that just doesn't lie in the walls of comprehensive dental science. That lies outside the walls of those that we build relationships with, and I think that's key as well.
And tying that back to the topic of the art of dentistry and the creative outlets. So when you're with this, right, with your patients, with your practice, you're taking small step by step. You're learning all the techniques and things you need to be successful long term, right? Because it's not going to happen overnight. Would you say that's your same approach to your guys' creative outlets as well?
Yes. Like behind me is a bit of my
Yeah, you see it.
studio, whatever that I and the funny thing is I have paintings from 5, 6, 10 years ago, and some that are more recent. And I don't know if you ever really finish, but you understand that there's a pace and there's emotion to it, and there's it, you know there's a process to it. So I think that when it comes down to translating that into business, there is step by step process. The But through the eye of an artist, you almost see, you can kind of see this with in other mediums, where you feel like everybody should see this, everybody should hear this, everybody should know this, but that takes time, and it takes its own process. So that has to be controlled as far as how you want to pace yourself, because again, you get excited. When I paint, I could start something now and it'll be 4 a.m. and I'm still going. And it's just like, wait, don't you have patience in the morning? Oh God, I got to go to sleep, but you get caught in that process and you get real passionate about things. And so your drive gets a little bit amped up. And the great thing about having Darryl is that he is kind of that pacemaker. And because me, I'm an artist. We fly like that, whereas, Darryl is this is Darryl, and I'm up like this. So it works well because it controls, there is controlled chaos. And so we feed off of each other. And, that's why we're a great combination.
Yeah. Yeah, he definitely tells me that sometimes I'm too straight line. He's like, come on, brother. You gotta see it through my lens. I'm like, well, I can't. That's a part of being an artist. But you can try to explain it to me, and I can try to get there. But no, it's a great relationship just because of that. I think we feed off each other well, and we balance each other out tremendously.
Yes.
So for our listeners, right? So Dr. Beckles, you are someone who's just taken the scenic route, making all the dips and turns every which way, kind of like a ping pong. And Darryl is your straight line kind of anchoring you. And Would you say that's what's really helped you, is kind of just
That,
keep giving you that balance?
well, I wouldn't say ping pong and all over because I am a doctor, so I have to. Patients do have to see that I'm not all flighty and all over the place. What I get passionate. So like Darryl will pick it up as soon as he hears the octaves start to raise. Hey, chill, brother. You're doing too much. You're doing too much. And get me under control. But again, I get excited to the visions are really what makes things happen. So it starts here. So for me, because that's another thing that makes it so much easier. And Darryl pointed it out, to cut crowns, to do dentures, to do things, because I can see where it is, I can see where it's going to be, and I can see how it's going to end. And that's all compressed into here. So slicing it into pieces is where Darryl goes, okay, here we go. Let's slice these into pieces. And it makes it a lot,
More digestible.
smoother and
Yeah.
predictable. And also there's still room for adjustments and changes if needed.
Yeah, one of Dr. Beckles' dead giveaways is when he's excited as he starts using a lot of clinical and technical terms and like Dr. Beckles, I don't know what you mean. That's one of the dead giveaways.
All right. I'm just thinking, if I'm imagining if I was one of your patients and you started throwing all that jargon at me, and I would probably like, okay. I would probably be catching onto your excitement, be like, yeah, this is great. I don't know what it means. This is great. So I'd probably need Darryl in the room to bring him down.
Wait. So again, I have to adjust that, because with Darryl, I'll go into technical, because like my colleagues like Dr. Eddie Brown or Dr. Sean Bullard, that's what we do. We sit back with the ideas and we throw those terms at each other. But with Darryl being in the business with me, it's like, oh, I didn't adjust it. But when it comes down to patients, I'm very, very plain as far as the language, making it as digestible as possible. Because honestly, when you're sitting in a prosthodontist chair, we're not doing a single tooth. We're not doing a filling. We're not doing cleanings. We are either replacing all of your teeth, replacing most of your teeth, crowning most of your teeth, doing cosmetics. So it's going to be a lot of time in the chair, a lot of commitment. And I need to make sure that we're on the same level, because again, the technical language scares people. And I've learned that, over the years, it's been a while, but I've learned that when I first came out, a lot of new docs think that is fancy. That's the way of talking. I'm a doctor. I have a white coat, and so I'm going to say blah, 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 but once you start seeing that glaze, that deer in the headlights look, you've gone too far, and so Darryl doesn't get the deer in the headlights. He just goes, wait, chill. You, what are you talking about?
I use the term. I always tell him, Dr. Beckles, you got to paint the picture. You have to paint the picture. You have to paint the picture. Like, help me see it. Because if I can't see it, then I know that the layman can't.
Yeah.
So for the record, Dr. Beckles is very clear and uses layman terms with his patients, so they understand. It's only outside of that, when he's just bouncing ideas off with Darryl, that it can get a little crazy.
Yes.
So let the record show.
Let the record state.
And he doesn't fly around like a ping pong.
No, he's not a ping pong.
I'm pretty steady.
Okay, we gotta make sure our listeners know we're not putting a taint on your name there. Not stained. You're good to go. You're still golden. Okay, so one other question that I had too, I think, and our listeners are probably thinking that. So you are an artist, but how would they? Let me reword this. What if we have one of our listeners who was like, hey, painting and just art is not my jam. How can I still find an artistic outlet that'll allow me to transcend across my professional and personal life like you?
Well, there are. So here's a funny story. You guys already know I wasn't destined for dentistry. That wasn't in my mind. I did want to be a doctor, and I think that was because that was what kids talked about, a doctor, lawyer, astronaut type of scenario. But um, I really wanted to be a special effects artist. That, like, watching the movies, watching the horrors, the gore, I wanted to do all of that. And the interesting thing about it was that I literally stumbled upon dentistry, from my mentor. But the way that they cross paths, literally, in prosthodontics, I was doing a little bit of what they call maxillofacial prosthodontics. So when you look at people who have lost portions of their face, their eye, their nose, their ears, or whatever, whether it be trauma through maldevelopment or something of that nature, or cancer, I was making orbits, nasal, auricular, or the eye, the nose, the ear. And the lab techs that were assisting me, they were lab techs part time, but they were full time special effects artists. They taught us the coloring, they taught us the latex, they taught us the fibers to make it look like there was blood vessels in the tissue, and so it almost came full circle. So for those who are artistically inclined, you have to look at the jobs and the careers that require that manual dexterity, that being able to take it from here and straight to here, and that's a big that's a valuable skill, and I think a lot of people don't really. Not saying they don't respect it, but I don't think people value that they have those skills, and being able to translate what's in your head and either sculpt it, sketch it, or whatever. That's very valuable, and you just have to find that path. I would say dentistry all the time, because this is literally what we're doing. We're doing sculptures in millimeters in the dark in a hole. Like, I mean, it couldn't be any more challenging, but it really shows that level that you could take it to, or surgery, different surgery surgeons. I'm sorry, different surgeons in other areas of the medical field. It takes that, you know. So
Yeah, I
I
mean, I
guess
would.
that would be my advice.
Yeah, I would say, those that are looking for that outlet. I mean, how I found mine is you have to really find something that makes you forget about your work, something that makes you forget about your problems, something that really makes you what I call black out. And for me, it's sports. Like when I sit in front of the game and I'm watching the game, I could care less about anything else. Don't call me, don't text me. I'm focused on the game, and that translates to me going out and play. I play softball in the league and stuff, and that makes me it makes me want to get back to work because those things are my outlets. Those things are my refreshers. Those things make me breathe easy, and then I'm ready. My brain is ready to get back to work. Dr. Beckles is a great artist, and he's done it for years. But some people may just be searching for what that thing is, and that thing can be anything. So I think don't put yourself in a silo and think that art is just one thing, or art is painting or drawing or music. Just open your realms of possibilities to be anything. But just think of it as anything that makes you tune off, because that's going to make you a better
Yeah,
professional.
and that's such an excellent point, because people overlook things that they did as a child that they were very skilled at. Oh, that's I was a kid back then, and literally we are, you know, both doing stuff that we developed as kids and held on to and developed it over time, and it translated into our careers. So, that was an excellent point.
So it's not one size fits all when it comes to figuring out your creative outlet. It really is figuring out what it allows you to separate yourself and be able to kind of recharge, right?
Absolutely. And if I
Yeah,
could add, Mo, it's not one thing at one point in
Yeah.
time. It's a lifetime. Like it's a lifetime.
yeah,
The thing that I was interested in when I was in my 20s in an entry level position, it's not the same thing that I'm interested in now as a director, as a chief, officer, because my tastes have changed, my lifestyle has changed, my interests have changed, my responsibilities have changed. So, you have to grow. Just as you grow with your profession, you have to grow with your outlet, with your artistry.
yeah, and it definitely takes time. And I think especially for the young people that may be listening. Um, the way that people are coming up now in the social media world, and a lot of things are a little bit more instant for people, and they're instantly famous, they're instantly rich, and all of these things. It takes time to really develop and grow to who you are and who you're destined to be. And I say that because I see a lot of people maybe in their 20s and in their early 30s panicking, and it's like you really want to take the time to develop and find what you're going to be doing for the rest of your life, what's not going to break you down at the end to have you, in a hospice care, or crippled because you blew your back out, or your leg or something like that. It's looking at it and evaluating it, because that's how valuable you have to look at yourself. And so you have to go and say, hey, I'm going to be doing this, and I want to enjoy this, and I want to live a good life. And it really takes time in doing that. I didn't wake up and say, hey, I'm going to be a dentist, and then everything is great. It, it's a whole process of things. And it's a whole process of people you have to meet on your way, both good and bad, both supporting and both deterring you from your path. So you really want to, look at that process is going to take a bit more than what people think it will.
In their defense, though, Dr. Beckles, we were pretty anxious when we were in our 20s and 30s. It took
We
a while
were, but
to tell us to slow down. Yeah. Like, what you rushing for? Why are you rushing? Like, it's not
we
going
were,
anywhere.
but 11 years of school will sit you in your place for a while, because you just keep knowing that these things, this degree follows this degree, follows this degree. So you just ride that wave. and it's a terrible, it's a poor, it's a starving, it's a stressful, it's all types of that in that wave. But if you want to get to shore, you want to grow and build and everything, that should be the focus. So I didn't want to take it too far off the tangent, but especially with the younger people, they have to start looking at uh, a long-term plan, and actually each step taking a bit of time, because it really, if you want it to have that foundation and that stability, it takes time to build it, each layer. So that's let me get off my soapbox.
Mhm. You sound like the old head on the corner.
I know I do, right? I gotta
Youngin, you got
dot
to
my
do this and
graves.
this and this before you do this.
Yeah, you little youngins.
Well, it's and what you're talking about reminds me of just that cliche that Rome wasn't built in a day, right?
Mhm.
So we can't expect, if we have these goals, to have this great big, empire and city. It's not going to happen overnight. It just won't. There is going to have to have time be taken, and you're going to have to set those intentional goals to get there, and that's okay. That's the nature of progress and building. All right. Well, we are almost out of time, but we love to leave our listeners with a motivational tip. So if you guys could just have listeners take one page out of your playbook of success, what would it be?
That's a good one. You want to start, Dr. B, or
I
you
got
want me to go?
You know what? I'll start. I'll start because this is something that is personal to me, because it's something that I'm going through right now. And this is from my brother, right? And my older brother, his son Scott, retired New York firefighter, personal trainer, all of that other stuff. But, you know, he says all it takes is one foot in front of the other. That's all you need to concentrate on. You're not looking all the way down. You're looking at getting that one foot in front of the other. And it was basically talking about being consistent, being, following through on whatever it is that you plan on doing. And you don't want to you don't necessarily need to look at that hill that you're climbing, but you want to look at the steps that it's going to take to get up to the top of the hill. So that one, because I stick with that every day, every morning.
Yeah, to that point, and that's really profound, because it's something that it's a quote that I live by. I believe Eleanor Roosevelt said it. It's not about having the grandest intention, but about performing the smallest good deed. And I kind of look at it that way as well. I mean, we all have grand intentions. We all want to have that house on the hill, but it takes that one brick, one by one, just to get it done. And that's how we take this practice. That's how we take our careers. We take it day by day. and we see what small impact that we can make on that day. And at the end, and in 5 years, you never know. It might be 5 practices in, 15 dentists in. You never know. But day to day, we really focus on performing the smallest good deed and making the smallest impact so that it can grow to something grand.
You see, and we didn't even talk before.
We did.
Like that's, oh, okay.
Yeah, by small and simple means, you know, you come to pass great things. That's how's a tree grown? A small seed. You got to plant it and give it the care little by little.
Absolutely.
Thank you, guys. Well, that is a wrap for today. Thank you for being with us, Dr. Beckles and Darryl. It has been great. And thanks to everyone listening. Don't forget to join the Happy Practice Playbook Facebook group, where we'll be discussing this topic more and sharing other helpful resources to help you keep your people happy. And as always, I'll be posting to get all of your tips and tricks as well. If you like what you heard today, hit that subscribe button so you don't miss out on the next episode. We'll hope you join us next time. It's your girl, Mo Jones.